Welcome to the Art of Medicine, the program that explores the arts, business, and clinical aspects of the practice of medicine. I'm your host, Dr. Andrew Wilner. Today, we're going to broach a difficult topic, the treatment of autism. My guest is Emily Santagati, Chief Clinical Officer of the ABA Centers of America. Emily is going to tell us what ABA therapy is and how it can help children with autism. But before we get started, I'd like to thank our sponsor, locumstory.com. If you're considering locum tenens, either full-time or on the side, you probably have a question or two, or 20. Fortunately, locumstory.com has the answers you need. It's packed with unbiased information and advice from physicians like you. Locumstory.com has nothing to sell. It's simply a resource for information. You'll find super handy tools that let you see locums trends for your specialty, compare different locums agencies, and there's even a quiz to help you decide if locums is right for you. Locumstory.com is the perfect place to start if you want to learn more about locums. And now I'd like to welcome my guest, Emily Santagati. Emily, welcome to the Art of Medicine.
Thank you so much for having me.
Yeah, thanks for your time and sharing your expertise. So to begin, tell us a little bit about your background, your training, and how you got involved in the treatment of autism.
Sure, absolutely. So for the last 10 years, I've been working with individuals with autism and other developmental disabilities. I actually found I really loved working with people with disabilities when I was in high school. And what I really loved was the perspective that they brought, just a differing perspective on the way that they see the world. People with autism see the world in a different way. And it was really valuable to me, that diversity in perspective. So I really enjoyed working with individuals with autism from high school. And so as I went into college, I thought I wanted to go into special education. I really don't quite like curriculum. So what I really loved looking at was behavior. I found that I was very compassionate, had a lot of compassion for the individuals who were engaging in challenging behavior and aggression or self-injury, things like that. And so that brought me into the field of behavior analysis. And so my credentials, I am a board certified behavior analyst. I have my master's degree in education with an emphasis on ABA. And I also have some state licenses in multiple states as well.
All right, so tell us, what is ABA therapy?
Sure. So ABA actually has its roots in behaviorism. And so if you go all the way back to 1913, John B. Watson talked about how psychology as a field really wasn't as scientific, didn't have that scientific vigor as the rest of the hard sciences like biology and psychology. We did a lot of, they made progress with their depression because of introspection, or they were able to change their behavior because of their unconscious things that we couldn't see, things that we couldn't measure. And so he really had this call to action that we need to be able to see things in order to change behavior. And so that is where we came from all the way back in 1913. B.F. Skinner did a lot more than just hang out with rats and pigeons. He did a lot with humans as well. And so he provided a framework, which is radical behaviorism. And so I say all of that to say it's not this one thing, this one type of methodology. It's actually a collection of methodologies that we utilize that falls under the umbrella of ABA therapy. And so it could be something as simple as teaching a hand washing routine. It could be as complex as teaching complex social skills. We teach language acquisition, skill acquisition, and behavior reduction. And we use a lot of different tools and a lot of different methods to kind of get us there. But it's all based on science. It's all based on what we can see, what we can observe, and we take data. And I think that's really what sets us apart from possibly other branches of psychology, is that we take data on everything we do to show that we're making progress in skill acquisition and behavior reduction.
Right. So, you might not think about it, but I mean, children are expected to conform,
Mhm.
in a lot of ways that, well, that's what kids do, but some kids don't. For example, when kids go to kindergarten, they're all supposed to sit in a circle and the teacher's going to read to them or sing a song and everybody sit there and then they're all going to clap their hands. But some kids don't want to sit in the circle. It's like, that's not interesting.
Mhm.
So say you have a kid like that, right? He seems to be a
Mhm.
regular kid. Somebody somewhere said, well, he's got autistic traits or he's on the spectrum or something. It all seems a little vague, but this kid does not want to sit in the circle. I mean, he'll sit every now and then, he'll sit, but then he's wandering off. So how would you apply ABA strategy to that?
So first, I would look at the social significance of it. Is it really that important that he's sitting in the circle with his peers, or can we provide accommodations? I think it's really important to listen to individuals with disabilities and see, from their perspective, it's why should I conform? And is it really that important for me to conform? And so that's really the first step for me as a behavior analyst, is I look at how important is it? Certainly, there are some things that are very important, like you can't punch somebody when you're angry with them, right? You can't punch yourself, if you're frustrated, right? And so there are some things that are very socially significant, but that's the first step. So I would look at that. If it is very socially significant to sit in this circle, and sometimes we have to do things we don't want to do, I would look at what is reinforcing to that individual. So behavior analysis in ABA is really looking at positive reinforcement first. And so I know that we have, certainly we have history and there have been experiences that individuals have experienced punishment and a lot of punishment, but our field and our code of ethics really is based on positive reinforcement, utilizing positive reinforcement whenever we can. And so I would look at what is reinforcing to that individual. How can we set up the environment where you sit on the rug and then you get access to your favorite toy right after that, or you get access to your favorite activity right after that. And sometimes these simple shifts in the child's environment can facilitate that very meaningful behavior change. And so that's really the bread and butter of a behavior analyst, is we're looking at the environment, we're looking at what is motivating to the individual, and we're looking at how can we kind of help nudge them into engaging in a certain behavior that we want them to engage in order to access that reinforcement.
All right. Well, let's push this a little further. You mentioned, for example, a child who hits his health. So we were just talking about a behavior that we want to encourage, sit in the circle, and you could see how you might apply a reward. But what do you do if a kid is always, climbing on the counter top, in the kitchen, and he's trying, he loves to get the glasses and everything. And as soon as you turn your back, the kid's climbing on the countertop. Now, there's no reward you can give him because he's already up there. And how do you prevent him and sort of encourage him that, well, this is not socially acceptable behavior. This is not something that you can do.
So I look at what would I rather, right? What would I rather he engage in, or she engage in, right? And so if climbing is reinforcing, then I'm going to bring him to a park and get it out there, right? I'm going to try to replace that behavior with something that is more socially appropriate. Climbing is certainly something that many kids do with and without autism, right? And so what do? We bring them to parks. We bring them and show them here's an appropriate place. And so redirecting over and over and over again to the appropriate place, and then reinforcing, I love that you climbed, on the play structure rather than the counter. That's awesome. And so reinforcing that over and over again. I would also look at toleration. And so sometimes individuals with autism, and not only just kids with autism, but children in general, struggle with toleration, tolerating that something is not a choice. And so Dr. Greg Hanley has a really fantastic, it's called skills-based treatment, and it basically looks at tolerating and increasing toleration of things that, disappointment, basically. Tolerating disappointment, tolerating no, tolerating sitting in line for 2 hours, all of the things that, are inconvenient without engaging in challenging behavior. So we do have behavior analysts in the field that have kind of created some methods to help individuals tolerate when something is not available as well.
Give an example, please.
Sure. Okay. So I had let's say I have a client that every time the iPad is not available, because it needs to be charged, he might throw the iPad or hit himself or hit his mom, or throw himself on the floor and cry and scream uncontrollably. And so what we would do is we would have a fully charged iPad and basically practiced relinquishing the iPad over and over and over again and give it right back. And so kind of putting the power in his hands, in the child's hands, and kind of this is a safe space. We're just practicing. We're practicing giving something up, staying calm, engaging in some emotional regulation, practicing some coping skills, and then we're going to give the iPad right back to you. And so then we delay it a little bit. Now I'm going to wait 10 seconds before I give you back the iPad. Now 20 seconds, now 30 seconds. And I can do that for hours on end. And so kind of this more systematic approach to tolerating disappointment, tolerating no, tolerating, when things don't go your way, and engaging in more appropriate coping skills. So I really like that methodology that Dr. Hanley created, because it is very slow and systematic, and it's not like a Band-Aid that's ripped off where the iPad's available and now it's not, and it just is what it is. It's this gradual toleration process that we're able to teach.
You mentioned an aversion to punishment as part of this kind of concept of ABA therapy. These days, it's not approved of in general to strike a child or whip them or put them in the woodshed, right? Those are kind of old-fashioned concepts. Although some will say they were used for many years with good success. Would you say that so are children with autism, do they not get it? In other words, if you were to punish a child, say by slapping his hand when he reached for something that he's not supposed to, which I'm not endorsing, but let's just say you did that. Are children with autism, are they less responsive to that kind of discipline?
No, I think it's just as devastating, for individuals with what I've experienced. It's just as devastating for individuals with autism. I think what happens is in not knowing what to do, people jump to punishment because they don't understand autism. And so they might jump to punishment much more quickly because they're like, well, what works? Parents, right? Parents are, well, what works, right? I've worked with families that say, well, I had to spank him, or I had to, slap his hand because he wasn't getting it. He wasn't hearing my words. He wasn't understanding my communication. And so it's part of my job to go in and teach them how to teach the behavior, right? They want to teach that you can't pull your sister's hair. We can teach that without spanking them. We can teach them without putting them in their room and shutting the door. And so I think it's more so about understanding autism and understanding the ways in which individuals with autism learn best. That's really kind of what we look at. Rather than look at punishment. It's not about that they don't get it. They definitely do understand that. They have the same emotional responses of, crying and feeling angry with themselves, or feeling shame, the same things that we see with neurotypical individuals, for sure.
So it sounds like repetition is key, right?
Yes.
Yes, repetition.
Yes.
And it sounds fairly labor intensive. In other words, how does that work?
Yeah, that's really, again, what sets us apart from many other therapies. When you look at, if I were to go to a physical therapist, I'm probably going once a week for an hour. And that's, and then I'm expected to do those exercises at home, maybe every day, 3 times a day, something like that. Individuals that are receiving ABA services are often receiving 20 to 40 hours of direct services per week. And that doesn't even include the BCBAs that are working with the family, doing caregiver training, doing parent training, and caregiver empowerment to help them to implement what we're doing in therapy at home when we're not there. And so it is a very labor intensive process. We have what we call RBTs, registered behavior technicians, and these are people that have certifications. They have at least high school diploma or a GED. They take a course. We do a lot of training in-house. We have a really excellent, we call it the ABA Academy of Excellence. And it's our training academy within our organization to train our direct service staff and to train the BCBAs who work for our organization to better work with the clients that we serve and their families as well. So it is very, very labor intensive. And that's something that typically when I start working with families, I say, my job is to put myself out of a job. I know you don't want us in your home forever. I know you don't want us in your home for 40 hours a week for the rest of time. And so let's work really hard together. I'm going to teach you everything I know. We're going to work together. And we're going to kind of get ourselves to a point where everybody feels comfortable. The client themselves has mastered the goals that we put forth, and we can kind of part ways and they can continue to implement what we've taught them during that period.
Okay, so yeah, I mean, the kids may or may not be in school or a special school for most of the day, where presumably they're getting some of these therapies, hopefully, right? Are any of these ABA therapies provided in schools?
Depends on the school. Certainly I have some clients that are placed at specialized ABA schools where they do receive that one-to-one. I have some clients that receive maybe 1 or 2 hours of ABA a day. And then I have other clients that don't receive any type of ABA services. The school situation is a little bit tricky. Massachusetts has some great schools, great resources. Some other states might not have as great of resources, like New Hampshire. We service New Hampshire, so not all of the public schools offer access to a behavior analyst, access to RBTs, people that are qualified. And so that is a little bit tricky. They're not always receiving ABA. They might be receiving OT, SLP, PT services in schools, but not always ABA.
What is SLP?
Oh, sorry, speech services, speech language pathologist.
Speech language, and you mentioned OT, occupational
Yes,
therapy.
occupational therapy, and then physical therapy. Yep.
Well, it sounds like the ones that really need to understand this are the parents. How do parents learn how to do ABA therapy?
So thankfully, we are insurance funded. We are an insurance funded provider. And so the insurance company pays for us to go and actually do family and caregiver training. And so it's something that we actually are encouraged to do and get paid for, is to go out and work directly with the families and with their child to teach them how to implement a lot of the things that we're doing in therapy. And so the way that looks is, let's say I have a client that's receiving 30 hours of services, RBT services a week. They're receiving, they have an RBT in their home 6 or 7 days a week. I, as the BCBA, would go out for possibly 3 to 6 hours sitting with the parent and having them switch in and coaching them on working with their child and teaching them to do what the RBT is doing. And so it's something that that's recognized as really beneficial by not only research. It shows that leads to better outcomes, but also the insurance companies also see that and they see how beneficial that is, and so they do allow for us to go in and do that. So we are very fortunate in that we do that, and again, our company really pushes that and emphasizes that. It's something that we have standards for all of our BCBAs right now in the field. What we're seeing is there are so many clients that need help, and BCBAs are overloading themselves or getting overloaded with so many clients that they can't really give the parents the attention that they deserve. And so what we do is we have a smaller number of clients that BCBAs manage so that they can really give the time and attention to the parents that they deserve, and that they are able to go out and support them and help them work with their child. So that's something that I'm very proud of within our organization.
Yeah, that sounds terrific. Well, I can imagine that this kind of therapy is physically, if you're dealing with a small child or an adolescent, is going to be very emotionally and physically demanding to the caregiver. You're not just explaining something and then it's like, okay, it's like there's a lot of repetition and a lot of yeah, incremental gains, probably. In other words, it doesn't get fixed overnight, so you're struggling. Um, so you mentioned New Hampshire. Is your company nationwide, or does it work in New Hampshire? How does that work?
Yeah, so we have clients that we're currently serving in New Hampshire, Massachusetts, and Florida. We are in 1 month going to be opening in the Philadelphia area. We just actually donated $1 million to Temple University. We are starting an autism lab with Temple University, and so we will be in the Philadelphia area, and then we will be moving into New Jersey, Cherry Hill area early next year as well. So we are a multi-state, and we're continuing to expand with plans to go up and down the East Coast. And from what I hear, the CEO is also possibly exploring Texas as well.
So I guess you need state licenses. It's a state regulated therapy.
Depends on the state. What's interesting is, ABA in terms of regulation is so new that I think that the latest numbers are 30 something states have state licenses. In New Hampshire, there is not yet a state licensed for behavior analysts, but in Massachusetts there is. If Florida does not have a state license, so I have a state license in Pennsylvania, I have a state license in Massachusetts, but I do not have a state license in New Hampshire and Florida because we don't have it. So every state really is different at this point. There's a national license, the BCBA certification, and that is through the BACB. That is what we all have, but then every state does something different.
You mentioned outcomes. I mean, I think every parent who has a child who's been diagnosed with autism wants to see their, child be like a regular kid, right? A typical kid, be able to sit in the circle and play sports and follow directions and have positive behaviors, right? Not negative behaviors. So, in how, what happens to kids with autism? Say a kid's 4 years old and diagnosed with autism. Are they going to become a typical child when they're a teenager or not? Or how do they know? Or how does the therapy influence that?
I think what's interesting is we're starting as a field to move away from this idea of getting them to become typical, getting them to become, status quo, right? And leaning more towards what the disability advocates we're listening to people with autism and we're listening to disability advocates, and we're trying to look at, let's celebrate the differences. Let's celebrate the differences and the diversity that we have with individuals with autism. And so what I try to do is I try to help families reframe what success is. And so sometimes, I have a family that comes and I'm like, well, what do you want for your child? I want them to be happy. Well, they don't need to be, sit in a circle and act, the same as all of their peers, right? They don't need to do that in order to be happy, right? And so we look at that, and we also look at, what is socially significant to the family, and we celebrate every little success. I have one family, I've had a family that when we sat down and started, what's your goal for your child? I want them to sit at the dinner table with us and eat dinner. Okay. And that's what we worked on. And they were able to sit at the dinner table by the end of, a couple months and eat dinner with their family, and then go off and do what they really wanted to do, but still engage and do what other people wanted to do for a little bit and tolerate that, without hurting themselves or somebody else. And so I think, kind of to answer your question, we're reframing it. We're looking at it differently. I have individuals in my life that are very close to us. My husband and I have a friend. We had a COVID wedding. So we didn't actually have a wedding, but our friend was supposed to be in our wedding, and he has autism and he went through specialized schooling. And, he has struggled with getting and holding jobs. But he has a girlfriend and he has a good life and he can support himself, and he needs a little bit of extra support sometimes, but in general, he's happy. And so does it look like somebody that is climbing the corporate ladder and, making a lot of money or anything like that. No, but that's okay. And there are many individuals with autism that are doing that too. So I think it's really reframing kind of what success is and helping families understand that their child is perfect just the way they are. And here's how we can help them live a happy life.
Well, I think that's great, but I think it's a little bit of a cop-out. I mean, kids need to grow up and they need to be able to live independently and get a job,
Yeah.
care for themselves. I mean, the parents aren't going to be there forever.
Yeah.
And that's a real challenge. I mean, it's nice to be, happy and jumping up and down, but they have to be able to deal with the real world. I think all parents would have that, as a goal. Although I agree with you that perhaps what our definition of success certainly needs to be individualized, and that, of course, for everyone depends on their own potential. But sometimes I think with children with autism, their potential is compromised by their behaviors. They may be very smart and bright, and yet, if they can't succeed in school, then they can't become engineers, even though they might have the smarts to do it. If the behavior doesn't, let them sit still, then they're really struggling. So is ABA
Yeah.
appropriate for that kind of scenario?
Absolutely. No, absolutely. And I think, you're absolutely right that yes, they do have to learn to live independently. They do have to need to learn how to ask for help and brush their own teeth and things like that, or ask for help brushing their teeth or whatever, right? So the communication is really kind of what we focus on, self-help. And I think it also depends on if the individual with autism has an accompanying intellectual disability as well, because that certainly impacts outcomes, that it's slower to maybe acquire skills and to decrease challenging behaviors, and the likelihood that they'll be able to live independently, without, being in a group home or some type of support, things like that. So I think that is autism is such a wide spectrum, so it is kind of hard to say. But what I've seen over and over again is individuals with autism, with support and with intensive therapies, have been able to kind of change the trajectory and be able to learn how to tolerate, learn how to take care of themselves, and kind of live in this society for sure. Absolutely.
Yeah, well, that's what you live for, right? That's the whole idea, is to help each child achieve their potential.
Yeah, absolutely. Absolutely. Yeah, that's really what we're here to do.
Well, this has been a great discussion. Is there anything else you'd like to add or tell us about ABA therapy or your organization there?
Yeah, I mean, I think our organization is very special in the way that we are so client focused, and we really go above and beyond over and over again. We talk about being, this is a silly analogy, but being the best cheeseburger, and there's a whole story to that our CEO, goes on about, but we're the best cheeseburger. And so we have these, what we call best cheeseburger moments. And so we talk about the things that are that we're very proud of within the organization, and we start every meeting with something that we're proud of within our company. And so I hear stories of people, there's a family that said, hey, we really struggle going to Target. So the therapist will go out to Target with them every single day that week to practice just with the child going to Target, right? I have some families last year, an amazing, we had a family that said, hey, we're nervous about Christmas. And so one of our RBTs went out and helped the families open presents on Christmas, and helped the child, open presents and share, with their sibling, without any fighting and things like that. And so I would say that the focus on being client-centered is really, really important. If you're somebody that's searching out for ABA therapy and you're searching out for a therapist, you're searching out for support, looking at, does the company have that as a value, where they're client-centered? Are they going to meet us where we're at, or are they going to force us into the hours that they want us to do and the place that they want us to do it in a clinic or something like that? And so we have in-home services, we have clinic services, we have community services, we go into schools, We really meet people where they're at. So I would say that really sets us apart. And that's what I would encourage families to do, is really interview the people that you are bringing into your home and you're bringing into your child's life, and make sure that your values align. Other than that, if anybody has any questions or has any interest in services, ABA Centers of America is our company. My email is, esantagati at avacenters.com. And we have an incredible admissions team that works 24/7 that will pick up the phone when you call, which I absolutely love, because that's something that's pretty unique about our company as well. So we are here to help you.
Emily, I want to thank you very much, and I'll put that information in the show notes. Well, I want to thank you very much for joining me on The Art of Medicine.
Thank you so much.
Before we close, I'd like to give another thanks to our sponsor, locumstory.com, a resource where providers can get real, unbiased answers about locum tenens. That's locumstory.com. I'm Dr. Andrew Wilner. See you next time. This program is hosted, edited, and produced by Andrew Wilner, MD, FACP, FAAN. Guests receive no financial compensation for their appearance on The Art of Medicine. Andrew Wilner, MD, is Associate Professor of Neurology at the University of Tennessee Health Science Center, Memphis, Tennessee. Views, thoughts, and opinions expressed on this program belong solely to Dr. Wilner and his guests, and not necessarily to their employers, organizations, or other group or individual. While this program intends to be informative, it is meant for entertainment purposes only. The Art of Medicine does not offer professional financial, legal, or medical advice. Dr. Wilner and his guests assume no responsibility or liability for any damages, financial or otherwise, that arise in connection with consuming this program's content. Thanks for watching. For more episodes of The Art of Medicine, please subscribe. www.andrewwilner.com